All right, guys, what's up? It's your boy Angel here with Quin for a little Q&A for on that Plandemic video that we've all been seeing going around. And I'll tell you how you been, Quin.
I've been good, man. I just been, alone, alone but not lonely. Just in quarantine. I'm glad we're doing this because it gives me a reason to talk to somebody.
It's tough out here. This quarantine, we're on what, day 60. It's
Oof.
it's hard, but
Yeah.
but back to this Plandemic video. Why do you think it's important to do this?
Yeah, man. Well, first of all, I
And
just
what it
think,
is? Yeah, what is it that we're doing here?
yeah, well, okay, so like I think I posted on Facebook a little like some time ago that I would put something together and do some research, and then you were like, "Let's do this," and I was like, "Let's do this." It ended up taking a little bit longer than we wanted because life happens, but and there's been and we've seen a lot of like responses like debunk pandemic like publications come out,
hmm
but we figured that we should still do this because we did find some interesting things, and yeah, there was like we want to get back to our people, like people
and
like
I had
yourself.
people directly reach out to me asking me what I thought
Exactly.
about it and what my opinions were.
Right,
Um,
right.
so I do think it's important that we get this out there. Um,
Absolutely, absolutely. So
what?
just real quick, I want to just it's all about, for me, it's all about like calming anxieties. Like it's not about like getting into a debate. It's not about like ridiculing people who posted the video. It's more about like we're living in a time right now during this crisis, like where people's anxiety is through the roof. People are like, there's mental health issues and concerns. And these videos, like anything that's going out there that's increasing like the level of fear and anxiety, I think it really needs to be looked at. Like, and if it's causing unneeded fear, like I think we should talk about that. You feel me?
And for those of you that don't know or why it would be important for Quinn and I to do something like this, I was actually on the local high school committee here, so I
Mhm.
have a lot of people that reach out to me for questions or opinion or for asking for my opinion on whatever, what have you. Anyway, Quinn is actually a researcher, and I'll let him explain more of that and talk about the kind of research that he did about this video.
Yeah, so just like naturally, I think we make a good little like tag team for this because like you're involved in the community, and I work at a university, University of Vermont, where as a researcher. So I'm not a medical researcher, but I deal in some of the same, when it comes to doing research, we have to do some of the same protocols. And so I could provide a little bit of insight about some of the claims being made in that pandemic video.
Awesome. So I'll tell you, when I first saw this, I honestly I didn't know what to think. Right? It's a lot of it. I was like, I wonder if it's true. Who knows?
Hmm.
Who
Hmm.
knows? Right? This thing. I was like, damn, what is this true? Like, the video is well put together. The production
Yeah.
is top notch. Um, the way they put it together, it makes sense. Could it be possible? Maybe,
Yeah,
right?
yeah, yeah. No, it's the
What
same
do you
here. Like
think?
I was spooked by it, man. I was spooked. Not only because it was like well produced, but like the people who sent it to me, like are people who are just like sometimes like there's certain people who like always believe every conspiracy
Yeah,
video that
yeah,
comes
yeah,
up
yeah.
and they're sharing it. And those people, I'm sorry, I love you, but like if you send me that, like I'm already gonna know like this is probably like I might watch it, but like I might stop watching it like 30 seconds in as soon as I see like the first red flag. Um, but this video was sent to me by like like some people who I really like love and respect, and
Yeah,
and
people
that
that
made
don't
me.
usually partake in these conspiracy circles.
Exactly, exactly. So that's, yeah. So this is
It
super important for me
penetrated the
to.
mainstream.
Yeah. So it wasn't just that; it was like effectively put together and like really dramatic. And they have doctors in this video talking, but also like the people who sent it to me kind of added like a certain level of severity to it. You know.
Yeah, for sure. So what do you think about Doc the Judy? What? How do you say her last name?
Oh, Makovich, I believe, Dr. Judy Makovich.
Should we believe anything she says?
That's a really, really great question, man. So she is a doctor, right? So you would think like if somebody's a doctor, like that carries a certain level of credibility. Um, but yeah, I did some really, really, well, not. really like pretty extensive research. I spent some hours of just like scouring the internet trying to find out like who she is and what not really and I was trying to back up the claim she's making, try to find evidence, and I really
Yep.
wasn't able to find much. In fact, what I found was stuff that contradicted what she was saying, not rather than corroborated. So for example,
You have
one
some
one thing that
examples?
I what happened.
No, I was just asking if you had some examples.
Yeah. So like the first thing that kind of threw me off was when I went to the Plandemic video website. So, and by the way, this is really important, like to note, because a lot of people when they share this video, they're saying, "Oh, you got to watch it before they take it down, or download it, or do a screen, record your
Screen
screen."
recording. Yeah.
Yeah, because it's gonna disappear. And then when you go, like, you can actually go on plandemicmovie.com and watch it there. Like, nobody's ever taken it down from there.
Yeah. The reason they take it down from like YouTube and Facebook, it's because it's a platform, right? So you're like, if you leave it on your platform, you're in no certain terms co-signing it.
Absolutely. Right,
So
right. So YouTube and Facebook and maybe Twitter, I don't know who else, they are taking it down. So it's true that they're taking it down, but it's the reason for them taking it down is not what people are saying. Like
no, you
I believe
can.
that they're taking it down because they're trying to protect themselves, because they realize that what's being spread in this video, the information is not it's not you can't back it up with reality.
With facts, yeah.
Yeah, with a lot of the stuff they're saying. And so if somebody ends up, for example, let's take somebody who has lost a close relative to COVID-19, right? And then they all of a sudden watch this video that looks very compelling and very convincing, saying that, yo, the government is actually trying to like kill people with this virus. Like they're letting it happen because they want to sell a vaccine, or,
Mm-hmm.
and they want to make billions and trillions of dollars. Like somebody who is in a vulnerable, fragile state emotionally, who watches something like that, is liable to do some really like destructive, like respond in a very destructive way if they see something like that.
And let's not pretend like our government hasn't been caught doing some shady stuff,
Absolutely,
because they
yeah,
have.
that's a good point. That's a great point.
So yeah.
Go ahead.
Go ahead.
Yeah, they like there's a history of trauma and deception, right? Like we know, like anybody who knows the history of this country knows that when it comes to biomedical research, like especially when it comes to marginalized groups, people who like Black people, Latinx people, like we know about the syphilis study, the Tuskegee syphilis study, where the government, well, I don't know if it might have been sanctioned by the government, the study, but yeah, a bunch of men were being treated for syphilis, even with a fake drug or something, just so that they could see what the effects were, and they weren't really told. I think they were never even told that they had syphilis or something like that. It was really, really messed up.
And the
Uh,
women of Puerto Rico were used as guinea pigs for birth control.
right. So there
So
is a history of like bullshit, right? Like we know this, right? And I think that's why it's so easy to believe these videos too, because folks are aware of the past, the questionable activities
mm-hmm.
that have happened in the past. So when something comes out saying this is happening, I think people who are aware of that are more likely to be like, yeah, see, this is just another confirmation. Um,
But let's get back to this Dr. Ninkovich.
mhm.
Um, Talk to me. What'd you find about her work and her arrest? And she claims that she was arrested with no.
Yeah.
Uh,
Yeah, but well, before going into that, I just want to really quickly say that it's really weird that the website, when you go to this Plandemic movie website,
mm-hmm.
there's no information about who created it. Like the producer, the director, nothing is there. And so the question I would provide here is, why would somebody do that? Like, why would somebody create something and not want to be attached to it? Um, I think it's a great question to ask. There might be many answers, but usually when you create something, you want to be attached to it. Like you're proud of it. Like, or if people have questions about it, you're like, direct any questions at me. Here's my email, that kind of thing. But I actually had to do some searching to find out that the person who produced the video is actually the guy interviewing Dr. Mikovich. He owns a production company. But anyway, I just thought that was really weird. Why wouldn't you want anyone to know who created your work?
Yeah, you usually want to put your name on your stuff. You're proud of the the things you're
Mm-hmm.
doing out there.
Mm-hmm. Yeah, especially a production like that. It was well made. But yeah, the question about her arrest. So yeah, she claims that she never got that she never was told what her charges were,
Mm-hmm.
and that there were,
She
they
was
made
held
up
with no
some
cause.
charges. Was that?
That she was held with no cause.
Yeah, yeah. And so if you start googling stuff and trying to find what actually happened, so it's documented. So this was a rare case where she was she was charged for taking data. This is a researcher,
Mm-hmm.
um, who was charged with taking data out of a lab and with her. And that was her charge. That was the charge. Eventually, the charges were dropped. But that's what she was charged with. So the reason she was arrested was because, so this was in Nevada. The research organization she worked for was in Nevada, I think Reno, and she got fired. And then she went to California, and then she got arrested in California because she was being. It was one of those things where they go like extradite you from a state to bring you back,
Yep.
so that you could face your charges. And that's what they did. That's why they brought it to Nevada. But basically, she was doing research on what's it called? Chronic fatigue syndrome. Yeah, CFS. And the reason she was doing that research is because the people that she worked for, the people who ran the research lab that she was working in, their daughter has or had CFS. I'm not sure if she's still with us. And so they're really passionate about like trying to figure out. Till this day, we don't know what causes chronic fatigue syndrome.
Mm.
So, and this is something that she was very, she wasn't clear about in that video. She talks about she never talked about what her paper was about. She said that Dr. Fauci like stole
Stole
her
her work,
paper.
or
Yeah,
held up her work
or
to.
right, so they can steal her findings and publish it themselves, right, and make
Yep.
money from it, right? So there was nothing about like the paper that was redacted from Science Journal was a paper that she wrote where she said that she discovered the source of chronic fatigue syndrome, the cause. Now this is blockbuster stuff, and in the video they mentioned, right, her blockbuster research, right, something like that. And it's like, yeah, that what her claims were blockbuster claims in the scientific world, because if there's a medical condition that no one understands what causes it, and then you're the scientist who says I figured out the
I
cause,
figured it out.
that's a huge deal, because once you know the cause, you have more hope of finding the cure, right?
Mm-hmm.
So this was a big deal. And what happened was with her study, the reason it was redacted from the Science Journal was because it was not the other scientists, her colleagues, her peers were not able to replicate her findings. And so in my line of work, well, when you have a finding that is huge like that, you have to be able to replicate the study. And if you can't replicate the study, then you can't say that it's um, like those findings. If you can't replicate it, it's
Yep.
more it's like they could argue that it just happened by chance.
And I also read that they actually funded a study for her to recreate it, and she wasn't able to.
Absolutely, yeah, like a $2.3 million national study with 300 different people sampled, um, where she was saying, just to be a little bit more specific, I don't want to waste too much time on this, but she was saying that she found the source of chronic fatigue syndrome in a rat gene or something, or a mouse, and that the reason that people get chronic fatigue syndrome is because that gene is they carry that same gene within their own bodies. And so
Oh.
they tested 300 people with chronic fatigue syndrome, I believe this is what happened, and they were not able to detect that gene in any of those people. So this was like a calamity. This was a massive failure, because this paper was published and they were basically telling the public, we have found the cause.
We
And
have found
then
a
when
cause.
they replicate it, even when there's all this money being invested into trying to replicate it, because a lot of people care about this, they're unable to. So Science Journal redacted the paper, means that they took it off of the press, and it was rare. That rarely happens.
Uh,
But
I'm sorry. Go ahead.
no, I was just gonna say that rarely happens. And then the people who she worked for, the people who funded, they're like these philanthropists from Reno, Nevada. They fired her, and they basically were like, "Look, man, we hired you to figure this out, and you ended up making us look bad, basically,
Yep.
because you published this research, and it ended up being, everybody was excited, everybody thought there was hope, and now there's like, we funded all this money to try to replicate it, and we couldn't. Like, they were like, you're trash. We don't want anything to do. I'm speculating,
Okay.
but I'm assuming that something like this happened, because they probably had a follow, and she was like, she had collected a lot of data to do that work, right? When you're a
Mm-hmm.
researcher, you're doing all this scientific work, you collect a lot of data so you can do your analysis and do your findings. But that, like, depending on the terms and conditions of your contract, where at the research institution that you're doing research, a lot of the time, the data that you collect, even if you, the researcher, collects it, if you're doing it while on contract with them and the work is for them, they're paying you to do that work. Oftentimes, that data belongs to them, not to
Okay.
you.
All right.
So she got fired, and she tried to take, and she must have been like, "This is my data. I don't care. I'm taking it with me." And they're like, "No, that's our data, and you better give it back." And considering the context, these people, their daughter has CFS, so they're like, "No, if you have data that's valuable, we're gonna keep
We're
that
gonna
data because we
keep
want
it.
to continue doing this work. Like,
We
if you
paid
take
for
the
it.
data, you're interrupting the work, right?" So
So,
I can see on an emotional level why they would file those charges.
all right. So she wasn't able to replicate her work, but so how did she go from being failing at that to getting arrested?
Yeah, so they, because she left with all the data, so this institute filed a civil complaint against her.
So the research
Um,
she was doing, she took it.
yeah, she took the
Okay.
data with her from the lab, and she took it. And the reason they know this is because, and this is, again, you can look this up in the San Diego Union newspaper. Report was reported on this in 2011. This is almost 10 years ago. 2009, between 2009 and 2011, this is when it happened. Um, one of her research assistants testified or confessed to the authority, to law enforcement authorities, that she took these notebooks with data notes on it in it, and that's how they knew that she had it. Well, they had someone, they had a lead, they had someone told them that she had them, so that's why they went to her house. And so in the video, she's saying that they're asking about these
Oh, and
notebooks,
then
this
she's like
data.
that they
She doesn't know what's going on.
planted.
That's why. She said that it was planned, that they were trying to plant it or whatever. But the funny thing is that if you look at the reports in the news, her own lawyer not confesses, but her own lawyer admits to the media that she surrendered the data after she was arrested. She surrendered the data so that they could drop the charges, and then they dropped the charges. So now, 10 years later, she's saying that none of this ever happened, when there's multiple,
She's
newspaper
trying to
reports that you can
rewrite
actually see
history.
this happening. They actually have links to the charges that were filed, in court. So, like, when you ask if she's credible, like, how can I think somebody's credible when they're saying one thing, but you look at court documents and
Court
newspaper
documents.
reports, yeah, that are saying, that like, they're saying all this stuff like happened in a timeline format, and she's like, lucky for us, we have the internet, we can look up these things, right?
And speaking to her credibility, one of the major claims in the video that she's talking about is doctors being incentivized to report deaths or inflate
Mm-hmm.
death numbers to report them as COVID, even if they're not, or if they're
Yeah,
questionable.
so this is a great question. This is something that I talked to the doctor I know about, and this doctor asked not to be named, and I'm going to respect that. So, um, but what I would suggest to anybody who's watching this is like, oh, you can't name a doctor, like, they might think that I'm just like making it up. So what I would suggest you do is, like, everybody, we all know a doctor. Like, we might not be like best friends with our doctor, but we all have a doctor, and your doctor is obligated to, answer your questions if you have concerns, whether they be mental health or physical health. This I would consider a mental health concern because it could cause anxiety or stress, right? So if I were you, I would call my doctor and ask them about this. If you don't want to believe what we're saying here, but basically, yeah. What I was told is that doctors are not being incentivized to claim that COVID was the cause of death. I was told flat out that is not true. I was told that, like, any doctor who's trying to provide false information could be delicensed or sued or fired, and it's just a risk that this doctor was like, it's not, it doesn't seem like whatever the incentive is. So there was this $13,000 number that was thrown out in the video. You remember
Mm-hmm.
that? And yeah, the doctor actually did talk to me about this and saying that it's possible that what's going on behind the scenes that doesn't involve doctors, and this is in the billing office, like the finance people in the
Yeah.
hospital, these are the people whose job it is to make sure that they can turn on the lights every day, right?
Mm-hmm.
So when you have a COVID patient, it's obvious that this patient is probably going to need a lot more medical services and treatment than a patient who doesn't have COVID, because COVID can kill you, right? So if it's a Medicare patient, Medicare pays the hospital to treat the patient, right?
Yep.
So, but the problem is that sometimes the testing, the COVID-19 testing takes, a day or two or three to get the results. So they can admit somebody into a hospital, a Medicare patient, right? And if they don't know whether this person has COVID, they just assume they might write in the billing information to Medicare that this person has COVID, even though they're not 100% sure, because it's a clinical diagnosis, which they're not supposed to do with COVID. Meaning,
Mm-hmm.
a clinical diagnosis is when you diagnose somebody just by their symptoms. You don't have a lab report saying
That it's
that it's
positive.
confirmed, right? So it's possible that because the billing people want to make sure that the hospital is covered financially. If this patient does end up having COVID-19, we want to make sure we're getting enough money to treat them, that they will prematurely say in the billing that this person has COVID just to make sure that they're covered. Now, people can probably get in trouble for that if they end up not having COVID. But
COVID.
you imagine the context of a situation where you have an influx of all these patients coming in, and you're trying to triage people, and there's like chaos going on. It's really likely that something like that might happen because it's chaotic, right? Like you're literally trying to save lives. You're trying to make sure the hospital can pay its bills at the same time. And you're going to be like, okay, if this person doesn't have COVID-19, then they don't, but we're going to make sure that we're covered just in case they do. And that's something that might be going on. And that's something that is, I think you might be able to tell by looking at how long it took me to explain that. It's something that can easily be misinterpreted as like it's a conspiracy. Like they're just lying on this paperwork.
And just because somebody comes back negative doesn't mean that the doctors didn't take all the precautions beforehand with the proper PPE,
Exactly.
and wearing all the gowns and having to switch out gloves and things. So they are incurring other costs that
That's
they
a great
wouldn't
point.
normally.
That's a great point. Obviously, think about it. Put yourself in that situation. There's gonna be precautionary decisions that they make that are gonna cost the hospital money, even if the patient doesn't have COVID, right? It's
Mm-hmm.
like, I don't want to use the word common sense, but like if you put yourself in the ICU, like you can try to
Give
imagine.
me all the gloves.
Word. What's the other thing is the death certificate. Another claim was that they were saying that they were
Listed
making it
COVID
up,
as a cause of death, even if it wasn't.
even if it wasn't, right. So basically what the doctor was telling me is that you have to put the cause of death, you have to put as whatever was the catalyst for the death. So this person might have lung cancer, you know, some other, high blood pressure, whatever. And COVID-19, their body's response to COVID-19 exacerbated whatever illness they had, and then they
Mm-hmm.
ended up dying. But COVID-19 was the catalyst, which kind of kick-started that whole process that led to the death.
So it's like
Then they have to put COVID-19 as a cause of death.
So it's like, sure, you had high blood pressure, you had a bad heart, but you were still alive. You got COVID, and now you're dead. So yes,
Right, right.
that would be
And that
counted
makes
as a
sense to me. I
COVID
don't know
death.
why folks would think that's weird,
I can have high blood pressure and be alive. That's
Right, right.
you know.
Um, so yeah,
And what
that's
about this claim about the hydroxychloroquine? What was it that they were saying
I
about it?
yeah, so in the video they're saying that the CDC has banned the use of hydroxychloroquine, a medicine that's really effective for fighting I don't know if it's Ebola or measles or something.
Lupus.
Right. So it's really effective for fighting another really serious illness, and that it's really good for fighting COVID. and that they're not being allowed to use it. And then they're saying the reason they're not being allowed to use it is because the government wants people to die. So I asked this to the doctor, and I was told, like, straight up, like flat out, like that's a lie. She told me that her patients right now are using, some of them are being treated with hydroxychloroquine, but the problem is you just have to be very careful because it's a very powerful drug and it's easy to overdose. So there have been cases where people have been treated with hydroxychloroquine and they have died. She actually went a step further and actually shared that there were restrictions on hydroxychloroquine before COVID-19, but because the CDC and the FDA are trying to allow doctors to do whatever they can to save lives, they lifted those restrictions as a response to COVID-19. So it's almost the complete opposite of what they're claiming in the video, which is that it was banned and restricted because of COVID-19, when in reality, according to a doctor who's in the field treating COVID patients, like the restrictions were actually lifted, not restricted. So that's a huge contradiction, to what they're saying in the video.
Speaking of contradictions, what about this? Their other claim that the media is just spreading fear.
Yeah, this is something a lot of people are saying. And we talked a lot about how the corporate, there is a corporate controlled media, right? We know this, right? Like the media is controlled by, a small number of corporations, or they're owned. I don't know how much they control, but I'm sure if you own something, you can control it, right? And it's all about money at the end of the day. Like if you look at media and marketing industry, it's all about who gets most rating, the highest ratings, right? So it's all about sensationalism, horse race media, meaning like whoever gets the story out first, whoever has the most dramatic story, whoever has the most, fancy graphics, whatever, right? And death, reporting on deaths is something that gets attention obviously.
Grabber.
Exactly. So I don't think they're interested in spreading fear as much as they're interested in getting high ratings.
Yeah.
Because it's all about making money at the end. The higher ratings they get, the more they can go to their advertisers and say, look, we got all these people viewing us. You can pay us $10 million more if you want another ad. That's what it comes down to. I really don't think it's about spreading fear. It's a coincidence that things that cause fear, news that causes fear, is also news that grabs attention, that attracts an audience, and that's the coincidence that I see happening. So
how about the other claim that the government knew this was going to happen?
Yeah, so people are saying that because they were planning for it, that they knew this was going to happen. So there's like a TED talk where Bill Gates is out there talking about, this is, we're going to have a pandemic. There's going to be a coronavirus. So the reason people like Bill Gates know about this is because Bill Gates is somebody, because he has all this money, who's invested in building resilient systems. And that's what the government's job is, right? Like one of the major public administrative duties is to design resilient systems and responses to massive crises, nationwide or statewide regional crises. So the reason I know this is because I took a public administration class about this very thing, public systems analysis and resiliency building. And what you do is you do like all that, like the centerpiece of all that work is contingency planning. So basically their job is to figure out what is the worst shit that could happen. And like, let's run the scenario and see how we respond. And if we suck at responding, then we have to improve our ability to respond. Unfortunately, the current administration doesn't believe in that. But if you are somebody who is a professional, somebody who really cares about doing a good job governing, you're going to want to put contingencies in place. And in order to figure out how to plan and design those contingencies, you got to run scenarios. You got to talk to experts. It's a whole field in academia for this subject.
What about this? The one about the Harvard doctor in the Wuhan lab.
Oh yeah. So this is
conspiracy going around.
So I had people send me the videos of like the doctor, the Chinese grad students from Boston University being arrested, and the doctor from the chemist in Harvard also being arrested. And what I was able to find, Reuters article, which Reuters is a very highly respected news organization. basically saying that this is the Justice Department put out a statement saying that this was a case of espionage, where the Chinese government does engage in corporate espionage all the time. Like that's why there's advisories, there's travel advisories. If you go to China, there's certain things like they tell you not to bring your phone into certain places. Like the State Department of the United States tells you not to do that because the Chinese are actively trying to hack all of our shit. They're always looking for ways to get a technological advantage over the United States. So it turns out that this Harvard doctor has been on contract with the Chinese government since like 2010, as what's called a strategic scientist, receiving millions of dollars from China, to help them develop, do research, whatever. And he was working in Wuhan. The problem, and here's the thing with Wuhan that I also learned. The reason Wuhan keeps coming up is that Wuhan is the place where the SARS virus was happened, I believe. Like this is where it's like ground zero. So there's a lot of efforts going on in Wuhan right now to backwards engineer some of these viruses, and that's where there's a lab. That's why there's a lab there, and this doctor was probably working in that lab. But there are a lot of United States scientists actually working in that lab. After this whole thing happened, Trump made a decision to make all of them leave. But there have been a lot of United States researchers actually working over there, not just from the United States, but from all over the world, have been working in that lab to work together to try to reverse engineer and come up with better ways to react to these viruses. So yeah, there was a case of espionage. Could there be something fishy going on? Maybe, but we can't be like drawing connections unless we have hard evidence. Like it's very tempting to do that, but I think we have to. Right. And espionage happens. Like we have to. I'm actually glad that they got caught. Right. Like if they're really spying. If it was really a spying situation where this dude was spying on the United States or helping or using United States technology and knowledge to give an advantage to China over us, let's be honest, like that's a good thing that they were caught, right?
For sure.
Mm-hmm.
Anything else you want to
add? The only thing that if there's anything like suspect going on, I just think that so this is something that the doctor mentioned to me. There's this nurse who put out a video talking about how patients are not being treated with the proper amount of care by doctors. That is something that is well documented, especially if we're talking about people who are poor, people who don't have resources, people who are, marginalized.
Yep.
We know there's lots of evidence to show that based on your identity, you get treated worse by medical professionals. We know this, but this is a case of implicit bias. This is like racism, classism, that kind of stuff. Like we know, for example, Black women when they go to the hospital do not receive great treatment, like on average, or I don't know if it's on average, but are just less likely to receive the care that people need. And so this is something that ties into this for me because it's like we want to talk about what are things that are happening in the medical field that are not being addressed. Mm-hmm. And this is one of them, right? This is something that I think if we want to put our focus into the medical field and look at an area that needs attention, like let's look at that, and I do believe it's possible that certain people are not given the medical care that they want. But it's not because doctors and the government and Dr. Fauci want people to die. It's more because of disparities and discrimination. That's. And
I saw that video you're talking about.
Mm-hmm.
And I do think it's possible that people or those doctors are just reading off a script and just setting those machines to whatever settings they were told these are the proper settings for COVID patients without actually looking at what's actually going on and treating
right. Those. And I can imagine again with the chaotic situation. Like I think that nurse was reporting from New York. Like I think she works in New York City. New York City is an extreme case. Like their hospitals were extremely inundated. There were people coming into through the front door with COVID, and there were people being wheeled out the back door as dead bodies. You know what I'm saying? Like that's literally how bad it was at a lot of these New York hospitals. So if you have overworked doctors and overworked nurses and staff who are working on sleep deprivation and stress and like sadness from not being able to see or touch or be next to their family and loved ones. I can
It's
definitely
extreme
see
conditions.
extreme conditions. Yes, I can definitely see how somebody working under those extreme conditions is not going to be the most effective practitioner because we're human beings, right? Like,
Hmm.
and unfortunately, I think in that context, the likelihood of tragic mistakes that lead to people being killed is going to just go right up, man. And it's sad, but is the reality. It doesn't mean anybody's like planning to or anybody's doing anything intentionally. It's just that mistakes are going to be made. Like the likelihood of mistakes being made are going to increase.
For sure.
Yeah. And I would also just say that like I understand like these are really tough times, man. Like I think that people are grasping and clamoring for like an explanation. Like this is a really tough like yo, we have been knocked on our asses. Like life has changed for us completely. And I think a lot of folks are just like don't even know what to think of it. So when you see a video coming out of the blue where everybody's sharing and everybody's saying, "Oh my God, this is real,"
It gives some
I think it's
validity
much
to it.
easier to believe because we're in trauma brain right now. You know what I'm saying? We're dealing with panic, we're dealing with uncertainty, we're dealing with like you got to look at it from a psychological level. And then you see a video that's like well produced with really dramatic music and dark colors. Like, I just want to say one thing. There's a really good Reddit post, and we're gonna share it in the description. That talks a lot about this. It has over 1,000 comments, and a lot of these people who are commenting are like medical professionals themselves. We're gonna link it. Check it out. It is probably the best, like most,
Concise.
cons- well, if you have time, it's 1,000 comments, but the introduction is really concise and easy to like. It has all kinds of links, all kinds of evidence, and really rich discussion happening about what we should know, like what we should believe and what we shouldn't believe, and yeah, that so check that out if you have the time, and that'll really kind of help you see what's going on here.
All right, guys. Quin.
Yo, thanks for tuning in, y'all. Have a good night, my brothers and my sisters. Yo, I'm gonna sound like damn, what's his name? The Harvard professor with the afro. I just saw him today in a video.
I
He's
don't
always
know.
like, my precious brothers. But anyway, yo, peace out, y'all.
Have a good night.
I hope that helped.